This is the Northamptonshire Carers Podcast.
Hello and welcome to the February Northamptonshire Carers Podcast. As ever, if you want to get in touch with us about this podcast or ideas for upcoming ones, things that you might like us to talk about, or even if you maybe would like to come and have a chat and talk about something that is specific to you in terms of your caring role, or how you might get through the challenges that emerge from being a carer, then always happy to hear from you. You can email if that's your thing, podcast@northamptonshire-carers.org. You can give a call to the office, 01933 677 907 is the number. And a very warm welcome to my guest for this month's podcast, Dr Jitka Vseteckova from the Open University Faculty of Wellbeing, Education and Language Studies, which is a bit of a mouthful, but I didn't trip over it, so that's good.
Fantastic. Good morning. Hi, Adam.
Hello. I know there's a number of things that we'll talk about in our conversation, but I wondered if, particularly because I attended a session that you did for us, a number of us here in Northamptonshire Carers, that was around the Take 5 to Age Well initiative. So I wondered if we could sort of start by just sort of unpicking that a bit and telling us about that whole sort of project, if you would.
Okay, of course. Thank you. So the Take 5 to Age Well is an initiative. It's a public health intervention that stems from the Aging Well public talk series. Aging Well public talk series is an educational intervention that really started at the times when I was a PhD student, and I was invited to actually share with the public back then at Charles University in Prague what is aging about, because I was studying, my PhD topic was around aging and how biomedical and psychosocial aspects of aging can help us regulate or prevent falls in older age as we grow older. And through this work, I've realized that there is a wealth of findings around aging, but unfortunately these are not easily accessible or available to the people who need them most. So since then, I've been engaging with public talks, public lectures, public engagement, where I was really keen to share what is it the evidence base says, what is it the research says, but in ways that are accessible to people who may not have never really studied, or that cannot access research publications because not many people outside of academia can. So there is a one thing about accessibility of those findings, but there is also this jargon, the language that researchers often use and are trained to use for good reasons. Nevertheless, it doesn't always help when communicating with public. So this is about 18 years ago where I've started. And then when I came to the Open University, I've realized that the time is probably right to actually start with my own series that I've titled Aging Well Public Talk series, that were structured around the 5 pillars for aging well that actually came about at about the time as I was doing my PhD. I've structured the Aging Well Public Talk series around nutrition, hydration, physical, social and cognitive stimulation, otherwise called the 5 pillars for aging well. And then this is what the Take 5 intervention takes forward. And we had a great, as sometimes amazing ideas come round when you hold half of it and then you meet with someone who actually says, why would you think about doing this, or why would you not think about doing that? And this is exactly what happened with the Take 5. My colleague, now lovely colleague, Rachel, who is a documentary producer by trade, contacted me to discuss blue zones. And I had to say, I love the idea. Blue zones are a brilliant thing to look at, to understand why is it people in those areas around the world that are called blue zones, that for example in America, in Japan, in Greece, etc. And they are known for people living longer and healthier. So looking at the blue zones might actually tell us what we may need to do. But the trouble for us is that we can't all move to the blue zones. And this is what I kind of told Rachel back then. And I said, well, my passion really lies in supporting people living to their best, living well and longer better, keeping well in the area where they live, where they come from. And then she had the idea about the pledge. So actually we took the 5 pillars, which were by then an evaluated and well-liked model, an appraised model of engagement. And we kind of modeled our pledge on Dry January. And we just added many other areas because pledges usually look at one specific behavior that they are trying to change. While we're looking at 5 areas on which we offer 3 to 4 different behaviors. So these areas were again around the 5 pillars, the nutrition, hydration, physical, social and cognitive stimulation. And we were really very keen to offer actions that are easy to do for anyone. Whether we are living sedentary lifestyles or whether we're fairly active, no matter what age we are, no matter what community we come from, no matter what is our ethnic background, we really try to structure the actions, to offer as many actions as we could think of would be helpful for people to pick their own, to make it easier, because the main reasons why we did this Take 5 campaign is to show that we don't need to climb a mountain to stay well, to keep well. We can do small steps, but we need to do them every day.
And it's that concept, isn't it, of those small steps that kind of make it doable, make it realistic, make people, I guess, sort of think, well, actually, I can pledge to this because, you know, sort of walking 18 miles, you know, sort of in a week might be a tall order, but walking sort of half a mile across a week, that might seem more likely.
Yeah, so small steps, something each one of us can do. And for some, it will mean that some will walk longer. For some, it means some will walk less. But if we keep walking every day, if we do a little bit in the morning, a little bit in the afternoon, a little bit in the evening, and that can vary. One can be gardening, what can be walking, something can be house chores, because it counts as exercise. But some of it can be also just gentle stretching. It's just not staying sedentary whenever we're able, not being sedentary. So small steps was one of the big reasons. Another one was that we don't have to do it alone, and we can have fun while doing it. So these kind of concepts brought us to how we shared the pledge, how we set the pledge out, and from what we're actually gathering back as preliminary findings, because we're still in the data collection zone. But from the data we've collected, some preliminary findings are showing us that people were able to engage. We had over 3,250 participants who signed up from all over the UK, from all 4 nations. And we also offered a provision in terms of offline pledging, because we were often kind of reminded, and it's something that we naturally know working with all the people, is that not everybody is techie and not everybody has access.
Making it inclusive then, isn't it, really?
So to make it fully inclusive and really to address the structural inequalities, we decided to add this offering as well, which was piloted with Age Scotland, and it was actually an incredible success. There were groups that were pledging offline. They were supported by a wonderful coordinator. And there is a huge story about the wonderful Super Snowdrops and other groups who pledge offline in Scotland, doing small things every day, having fun and not doing it alone. It's really a moving story. So I really hope that in our report that is due to come in a few months, we will really be able to portray that. But on top of that, we will also work with Age Scotland to provide kind of a guidance that we can then append to our project website. And when we speak to organizations, when they ask us about offline pledging, we will be able to say, we have prepared a bit of documentation here for you perhaps to go through to understand what you need to have in place to support the offline provision.
It's interesting. It's just sort of made me think that the sort of concept of small steps or tiny steps or whatever we want to sort of use in terms of the way of describing it, that I did a couple of podcasts, and I'm sure there'll be others down the line at some point, with Dr David Smart, who was a GP in Northampton for 30 years, is part of the local Action for Happiness group. And something that he talked about, I was asking him about his time in the NHS and what he saw over that 30 years. And one thing that he particularly identified was that, yes, NHS interventions are often necessary, can make a difference. But the thing that actually makes a massive difference, which is where it sort of comes in with the sort of the initiative that you're talking to us about, is that behaviour change can actually make a massive difference.
It can, absolutely. And in order for us to really make it as accessible as possible, we of course use the way of co-production and participatory approach. So from the Aging Well Public Talks, if I loop it back, the Aging Well Public Talks are co-produced, co-designed and co-produced with people with lived experience of aging. People that are aging come and contribute to the program and facilitate talks. And there are different stages of aging. Some people live with multiple conditions as well. Some other members of public who come and join and co-design and co-produce the Aging Well Public Talks are practitioners or professionals who support aging populations in their professional roles. So we really use the co-production and co-design to create those series. And then when it came for us to engage with the Take 5, of course, we used a very similar approach. So in our project team, there were not only academics who are behavioral scientists or academics who have different expertise, whether it is around nutrition, hydration, physical, social, and cognitive stimulation while aging. But these were also many stakeholders there was a GB from Milton Keynes from Modern Healthcare. We had a consultant, deputy medical director for mental health in the Northamptonshire NHS.
Right, yeah.
We also worked together with Hallmark Care Home and many other organizations, Campaign for Learning, the national charity. So we have worked with many organizations and their stakeholders to really help us make it as user-friendly as we can. And this is one thing we would love to focus on even more going forward. If we get the funding, of course, to roll it over, because it's not resource-free for us to put it together, but it is a free resource for everybody else that can take it up. But we would love to actually create an expert group that also brings together people from different ethnic backgrounds, people with who live with learning difficulties and their carers, and more carers, people who care for people with long-term conditions such as heart failure or diabetes, so that we really can make sure that we can co-produce the pledge in a way that can suit all.
Yeah, no, that sounds great, and that level of engagement is brilliant. Exactly what you want, isn't it? And I'm just sort of thinking, people that have got lived experience, that I'm guessing that having such a wide sort of range of people involved and participating and co-producing and all of the things that you've described really well, that I guess is potentially a way to identify. And I know, sort of some services, wherever they may be in the statutory sector or the voluntary sector or whatever, might work brilliantly a lot of the time, but there's areas that maybe from people's lived experience they can kind of feed into, actually, well, this would sometimes be quite simple. It's if this were to change it in this way, or this was done in this way, then it would work better, and it'd be a greater level of support, and people might not need as much support because some sort of changes that might be pretty straightforward.
Absolutely.
It might also save resources in the end, as well as saving people becoming frustrated and stressed.
Yeah, I agree, Adam. This is a good point. And this is in many ways why the collaboration we've been having with the carers in Northamptonshire has been absolutely an incredible, wonderful journey and very fruitful, because in co-producing the community assets and working with groups who live with multiple conditions or long-term conditions, such as people living with heart failure or people living with diabetes, for whom I'm actually doing another talk today, or people living with dementia, and the hubs that the carers in Northamptonshire together with the ICANN created across Northamptonshire. This is a wonderful initiative, and it really showcases the forefront of how health and social care would ideally be integrated. So it has been a huge privilege for me and pleasure to actually work with the carers in Northamptonshire and being part of that journey. In the end, we really do not need to do much. Every little step is helpful, providing we're doing it systematically, regularly.
Yeah, yeah. And it's that thing as well, isn't it? That it's, I suppose, about which we're probably not very good at as humans generally, or maybe it's just me that's not very good at this, is that it's kind of celebrating something that you've achieved. And that can be that you've taken a walk down to the shop to get the shopping rather than going in the car or on the bus or whatever. And thinking, well, actually, I've done that today, and it's much better to have done that. I feel good to have done it. It's much better to have done it than to have sat on the sofa or whatever it might, or watched more daytime TV or whatever, which has a limited appeal.
It is difficult. It is much easier for us to stay on the couch. And the times I've kind of created a routine for myself, for example, but every day going out for even a short walk, you don't want to. I want to stay on the couch too.
Same here.
But after I go, because I know that when I come back, whether it is after 10 minutes, 15 minutes or 20 minutes, I'm going to feel better. And so I do it for the after as most people do. And also the elite athletes. The elite athletes are not machines who just thrive and are happy whenever they exercise hard. There are people like everybody else. Through being outdoors, your mood changes. You feel better.
Yeah.
Our blood gets wonderfully oxygenated. We see things. We might see a neighbor. They might put a smile on our face because they say beautifully, hello, how are you today? And that's what makes us all happier.
Yeah.
So it's definitely worth it. But this is why creating the routine is so important, because it needs to become a habit. It's easier to go out once it's been made a habit because you go every day. But it's hard to kick yourself over the threshold, especially when the weather's not amazing. Like today.
Yeah, like when we're recording this. That's yeah. I think you're right. I think it's that sort of routine, isn't it? And getting into that new routine and making that behaviour change. It's a bit like going to the gym, really. It's actually, I can't really be bothered tonight. You find all sorts of reasons why. I'm a retired gym member, I might add. You kind of think, oh, I can't do that. I've got this to do. I've got the dishwasher to unload, or I've whatever, got the cats to feed. But yeah, once you do it and you get into that habit, and that becomes your new habit,
It becomes
that's one of the stumbling blocks to try and get over, isn't it? Really.
Exactly, and this is why the pledge was set in the way it was set. So we would invite people to pledge with us for 30 days, as it's usually the case with pledges. It lasts for a limited amount of time. But then we were also trying, and this is where we really worked closely with the behavioral scientists. So there is a research element that is nested in this engagement campaign that kind of looks at how do we create that routine, and whether Take 5, with the 5 pillars in it, has a potential to support diverse people across the UK to create new routines and to sustain those routines once the pledge has finished. So to this effect, we're collecting surveys. We have collected survey 1 at the beginning of the pledge, where we were looking at baseline behaviors and readiness to change. In the second survey, after the pledge, after the 30 days of pledging, we were collecting data about whether people were able to stick with the with the action they choose to pledge for. Now we will be soon inviting, hopefully, our participants to fill the survey number 3, which is going to look at whether they were able to sustain the new routines for 5 months after the pledge finished. And then we will hopefully do another survey in June to have a look at whether 9 months after the pledge finished, people are still sustainably.
Yeah, and it's sort of charting that sort of lasting impact and that ability to remain motivated.
With a colleague of mine who was also project team member on the Take 5 from the Open University, Josef Araya, who is doing research in environment and how environment fosters our learning. We're also doing series podcasts now around health inequalities, and with other colleagues, of course,
really interesting,
and health inequalities and how it changes our access to nature and learning, because being in nature means we see different things, we learn things. You see a bird and you're like, oh, haven't seen this before. we learn new things, and it changes the landscape, and it gives us a break from the digital world that we I don't know about you, Adam, but I sometimes do not understand, because there is so much to catch up with that it's just impossible to do.
I think that's
feel,
very true.
Well, being like we're setting ourselves for a fail because we're trying to catch up with everything. It's simply not possible. And then it doesn't help us thinking, it doesn't help with our self-esteem. The weather changes, the winter comes, days get shorter, and suddenly we're feeling under the weather more and more and more. And if we do not get ourselves, drag ourselves away from the computer, because it attracts us back, it wants us back, you have to drag yourself out, and it's not easy to cross the threshold of your house.
I think that's a very good point, and I think also, I love a smartphone. Most of us probably have them. But also that's another thing that, and again, I'm sure many of us have done this, that you kind of, you get up on a weekend maybe, and you're making a cup of tea or whatever, and you kind of think, I might be thinking, I should go out for a walk today. And I start sort of scrolling through stuff, looking at emails on my, not work, but emails. And before you know it, an hour or more is gone. You think, what have I done in that time? So I think that it's quite nice to get away from that as well. And I think it's great to think about things, empty your mind, but also think about things. I think you're right about, you sometimes come back with a different perspective. And if it is that you're going for a walk with somebody else, I think it can be a great way to have a conversation that you might not readily or feel quite so comfortable having if you're sitting face to face with them at home.
That's right. It is easier to converse with people and to share and to maybe even confide in people when we walk side by side without having to look at each other, because it doesn't always work, and if it works, it doesn't work for everybody. It is important. But there's another thing you've said earlier on that I took a mental note of to come back to. That you said, well, do shopping, feed the cat, do this, do the laundry, do the house chores. There's always something to do that kind of creates a convenient excuse of not kicking ourselves out of the door, right? But I think this is ultimately what comes in with caring, because we do as carers, we need to make sure that the person we care for has everything they need, and that often comes before we think of our own needs. So carers are an incredible vulnerable population, not only because they volunteer immense amount of their time and care and energy and love and thoughts into making someone else comfortable and helping someone else to get well or get better, or just manage. But they so forget looking after themselves, which makes them incredibly vulnerable as population. And the aging impacts on us all. It's not going to wait for someone to stop being a carer to have an impact. The aging is there every day of our time, and every year we feel slightly differently. Every 5 years, every 10 years, we do notice difference of how the aging kind of progresses. And this is where we're all on the same boat. We're all affected by aging since birth, and we're just at different stages of it. But the age doesn't wait for anyone or anything. And if we do not look after ourselves, which is easier said than done when we're carers or when we're in a situation where we care for a loved one, we will not be as resilient, and we will not be able to care as well as we could if we also take care of ourselves. So the caring needs to include us as the person who provides the care. But it is incredibly difficult, and it is sometimes difficult to actually talk to carers. We've done a lot of research about this as well, with carers as well, where people either don't identify themselves as carers, and then they kind of do not think they have this need, or they do not recognize their right for their needs, for their own needs, when there is someone else that needs their care. But as a young carer, as a mother as well to a now 8-year-old, which is not such a young child, but it kind of teaches you that if it is really difficult to give your best if you do not take a little bit time of the day for yourself to recharge.
Absolutely right. And I mean, I'd kind of be remiss if I didn't say at this point that obviously Northamptonshire Carers, we're very aware of the impact that caring can have, and pushing down your own interests and needs and being overtaken completely by the caring role and maybe experiencing physical health issues and poor mental health yourself, and isolation, which adds to poor mental health quite often, poor physical health, as we know. And I think that in my usual job, a manager of the Community Companion Service, myself and my two colleagues, Emma and Keisha, that what we do is kind of match up volunteers with a carer to give them a break, to give them some time for themselves. And it's interesting when people give you some feedback after they've been using the service for a bit and haven't been able to get a break, and then they get one. And just a few sort of things that spring to mind. I remember one person early on in the service saying, really sort of struck me, that she said that getting some support from the service and getting some time out gives me time to be me. That's really interesting.
So important, that it is an incredible intervention that you're actually bringing, an incredible initiative that you're bringing to the population of carers. Actually, I would love to do this, so you will need to tell me.
Yeah, absolutely.
All the details.
Yeah. Well, I didn't know I was doing some volunteer recruitment, but
there you go. You never know.
That's yeah. Oh well, I'm glad. I'm really glad that I wove that in, or weaved that in, or whatever the phrase is, to the conversation. Yeah, I mean it's and I think that we all have a range of identities. We're not defined by one thing, are we? Although sometimes you can find yourself as if you are defined by one thing, and I think being a carer, that does very easily happen. It's a key thing, I think, that you've mentioned there, which kind of neatly segues into the fact that you're chair of the Carers Research Group, and I wanted, if you're happy for you to speak about that and how you, I guess, develop that sort of interest in unpaid carers and finding out more about them and maybe how they can have a greater quality of life, I'm guessing is part of it as well.
Okay. I have always had an interest in caring. I was a young carer to my brother, who was born 5 years before me with severe mental handicap, with severe Down syndrome. And although he's now a 50-year-old gentleman, his mental age is probably between 2 to 3 years old. And we've always lived together. We're a very close-knit, tightly knit family.
Yeah,
is this
yeah, that's the phrase. Yeah.
And when we would go out and play in the playground, our parents or grandparents wouldn't always be able to be there, although they could see us from the window, but they would not be there physically. I would always take care of him, and that's how my carer's journey really began.
Yeah.
And it was an interesting journey. It was not without a fight, because children do not like children who are massively different.
Yeah.
So we would deal with all sorts of situations that I would handle as a younger, more reasonable, sometimes, sibling, which kind of brought a few situations in that I would probably not talk about today.
Yeah, sure.
But it has also taught me how important it is to really stay close as family and not avoid people who are different. Because we're all kind of different from each other. We're all individual. We have our differences. And when we can truly include people either with learning disabilities, severe mental handicaps or illnesses or physical disabilities or other in the community, and not thinking that they are different but we bring them in, but thinking of the society, of the community, that we're one. We're one community.
Yeah.
And we're all different. We all bring something. We all take something away. We all do it in our own ways. Was our life without argument? Absolutely not. But it was an enriching way and start to life.
Yeah.
Well, where you really live the inclusiveness. You don't talk about being inclusive because you are. There's no need to talk about it.
Yeah.
And this is how kind of my interest in caring began. And then throughout my research career, I was working with many colleagues in different areas, and I was fortunate enough to work with a team who was supporting mental health service users and the transitions between hospital care to community care, which was an NIHR-funded project many years ago. Fantastic project, fantastic team, and I've learned masses. And then I moved on to working with the Open University, and I was working more closely with other colleagues whose interest aligned with mine, and we started bringing the aging component in it. So we were looking at aging carers for people with learning disabilities, aging carers supporting their loved ones and without having access to dance classes or other hobbies or things that could give them the me time, which is so central for our self-esteem, for our mental health, for our mental health and well-being.
Yeah, definitely.
And so this is how I've been doing research with and for carers for many years now, and it kind of became a deputy chair to the carers research group at the Open University first, and now my colleague Professor Mary Larkin is retiring, and me and the colleague Kerry Jones actually are stepping into her shoes as chairs for the Carers Research Group, which I'm incredibly honoured to be in that place. And we're working with wider public, not only with academics, but also with people who support carers in their professional roles. We work with carers themselves. And most of us also have experience of caring, which is never too far away from you when you live in a family, because we are not always well, whether it is physical or mental health, illness or disability. We're not always well, and it is normal not to be always well, and
Definitely,
it is normal to have the family, friends, carers around to rely on. It is normal to ask for help. It is important to know to feel we're able to ask for help, and it is important to be able to say, I can help, I want to help, let me help. So it's been an incredible, a very privileged journey, and I was lucky enough to also work with people from different ethnic group, minorities, all walks of life, different ages. We do research around aging carers, we do research around young carers, we do research around carers that are in between the two ages. And it's a fascinating journey that I enjoy very much, and I've also been very lucky that I was invited to join Carers Bucks and Carers MK as their trustee, which is a role that I really take very seriously, and I'm proud to have in the community. And it's been an incredible journey working with carers in Northamptonshire, because we have done a lot of work, especially around co-producing community assets. And it's been so far an incredible time spent. Looking forward for more.
That's fantastic, and I think that as well, that you were talking earlier about sort of that lived experience, and I think that yourself and other colleagues that are sort of part of the research group, the fact that you bring to the table that real life from your own experiences of being a carer, I think that is so helpful in just understanding it, I guess, and as a result being able to understand where other people are coming from.
Absolutely, and not imposing the research we as researchers think needs to be done on people who actually feel, well, actually we need something else first. And if we do not go and ask, what is it you need? How can we help you get that? And then it kind of makes the research being a catalyst for a project that is essentially and should be driven by people with lived experience and their needs, because this is the only way to make it sustainably impactful. Which is where we really would like our research, what we would like our research to do, to be able to do, to have that impact, that sustained impact on generations of carers, and that cannot be done without them. It only can be done with them.
And just thinking about mental health, and I know that you're the academic consultant for Radio 4's mental health series, All in the Mind. If people haven't ever heard it, I'd recommend it. It's a good listen. So how did that come about?
So that was an offer that actually came about probably about 3 years ago, where my two colleagues from the Open University were already academic consultants on that program, and it's a program that has really run for a long time and is an incredible one. And when one of the colleagues retired, they actually approached me whether I would like to join the crew, and I absolutely jumped on this opportunity because it is an incredible team. It's been wonderful working with the OU team and the BBC team in the co-production and kind of having the door open so that you can peek inside on how the broadcasts actually come about, what needs to get done on the side that is not research and brings the data. So I've been a consultant on the series up until September, October 2023. So I've just kind of come out of it.
Yeah.
But it were lovely 3 years spent. And during this time, I hope what I was also trying to do was to bring a bit more the carers research and carers agenda into focus. So I hope that I have lobbied for and achieved a little bit more of a representation of carer stories and their mental health, because it's just so important for the society to have carers in it.
Yeah.
But as society, we need to enable the carers to be carers, and that's easier to say than do.
Sure, and I think that you're right as well to sort of pick up the fact that, well, it may well be the person that's being cared for that maybe not necessarily always is the main sort of health issue, but the person being cared for may indeed be experiencing depression or other sort of indications of poor mental health. But equally, the person that's the carer often experiences that too. And I think that it kind of does lead us to talk about whether you feel in mental health, whether attitudes have shifted in a positive sense a bit, what else there is still to do. And I know that during lockdown, actually, that there was a point where there was an acknowledgement about mental health and the impact of isolation and not seeing people, and sort of only being able to go out on your government approved walk and all of that kind of thing.
Absolutely.
That there was that acknowledgement that this was impacting on people's mental health. And I think there was a bit of an argument about, well, sort of lockdown's doing one thing, but it's also doing something else that is a side benefit that actually we'd rather not have had, which was around sort of people's mental health.
We'd rather not have had the COVID
around. Rather not have had the COVID either.
But since we had it,
Yeah.
I have to say that this was quite a hopeful, a positive opening, in a way, a silver lining, when
Yeah.
it was okay not to be okay.
Yeah,
And this is
absolutely, yeah.
such an important thing, because the chances are, especially with aging, especially if we're a bit dehydrated, don't look after our nutrition, lead sedentary lives, the chances are more than not that we will not feel well at some point in our lives.
Absolutely, and I think that's usual, isn't it?
And that's usual, that's normal. We're not machines. We cannot operate in a given way. Not one day is the same as another. And this is even more true for people who live with multiple conditions, because that incredibly influences how they feel physically as well as mentally. And I have to say that for me, the physical and the mental side and the social and the emotional part and psychological part, they were always one. There is not physical and mental health. There is one health.
Yeah.
Whatever happens in the physical sphere is mirrored sooner or later in the mental health sphere, in the cognitive sphere, in the emotional sphere, in the social sphere. We have many facets to us as individuals, and taking one independently of the other ones is, for me, a mistake. This is why I've always been kind of a huge advocate for holistic care. And since you brought the BBC co-production in, we have co-produced a very interesting resource. Last year, I was an academic consultant on a short film about a young lady whose misdiagnosis sent her to psychiatric hospital, where she was not supposed to be, because the problem was not her mental health.
Mm-hmm.
Nevertheless, it was kind of depicted at some point, and she got the treatment she needed. It took much longer, but she has been on a good way to recovery. And as we all know from illnesses, a recovery is a journey. It's not something that we're discharged from hospital in 3 days, we're recovered. We're not. Recovery sometimes takes years because there is trauma, things do not happen in an isolated way.
Yeah.
Nothing is isolated in how we operate as human beings. So it was incredible opportunity for me to be involved in that work because of the pushing the holistic agenda. And then it takes you a step further and you're thinking, are we really right to have healthcare services and social care services? And in some ways, I'm very kind of keen to see how now the integrated care systems that are coming around with the integrated care boards, how they can change that and what impact and support they can actually offer to people by not totally separating two things that were never separated in the first instance. So of course there are teething problems. It needs to be organizationally sound. It needs to find its way of working. But I can see it as a hopeful, perhaps, precursor to the ethos changing.
Yes, yeah.
And that brings your question back now, that actually what is there to do around mental health?
Yeah.
Well, let's do something about health. Let's make sure that we stay well. And let's not forget that in keeping healthy, we have a huge responsibility to ourselves. We have to own our health and well-being, whether physical or mental, if we want to separate it, which I really don't. But we need to own our health, and we need to be partners in our healthcare. And this is also the ethos that then brings us back to the Aging Well Public Talks and the Take 5. This is what they try to do as well. It's bring the ownership to people, because the health is ours. Our health is so important that it cannot be effectively outsourced to a third party.
Sure.
No matter how knowledgeable and amazing our GP and nurse and consultant specialists are, the health is ours. This is why we need to be partners and try to find ways to talk and discuss, because what often happens is that people get prescribed medication, especially if they're older, but not only when they're older. This can happen when people are younger and are just not feeling fit to discuss or advocate for themselves. They get prescribed medication, and then a few days later they realize, oh, I'm just more tired, and being more tired leads to being more sedentary. Being more sedentary leads to feeling stiffer whenever we have to get up, because we have to get up every now and then. It doesn't make us feel likely that we will go out for a walk or stand in the garden for 5 minutes. It doesn't bring us to the point where we want to actually just go out and wave hello to the neighbor. We then stay sedentary, get isolated even more, and very often we get dehydrated as well, which is a very crucial problem when people take multiple medications, because the system slows down with dehydration. Our metabolism doesn't work as fast, and the longer, that means that medication may stay longer in our body, and the longer the medication stays, the more there are chances for side effects and drug-to-drug interactions, which is a huge problem and brings many people every day to hospitals with fractures, especially if they are elderly. But it is not, again, as I say, it is not only problem for the elderly. So not feeling that we're not able, or we don't have the agency to actually go back to the GP and say, look, what you've prescribed may work for the problem we're talking about, but it makes me more sedentary, and if I don't move, there is a whole corollary of issues that will happen as a result of that, and I will be only less healthy because of the side effects, not just the treatment or not the problem that there is at the beginning. The advocacy, feeling that we need to have this conversation because it is life-saving to have these conversations, is something that the Aging Well Public Talk series have at heart, and it's what we try to empower people to do as well.
I think that there's loads of things there that really sort of resonated with me, and I think that one is everything is interconnected. You can't kind of sort of put it into a little silo somewhere. And it's important to recognise that. I think something else that you said, which was about integration of health and social care, or lack of it, which has historically been the position, is problematic in a number of ways. And I think that there's also that thing sometimes that people experience, and if we've had family members that have gone through sort of health issues in the hospital system and all the rest of it, then I think that sometimes it might be that there are a number of different departments that are involved. But there's a kind of, not always, but fairly often, there's a kind of lack of connectedness between the two. So somebody might be under the care of oncology services, for example, but they've also got other issues that might be to do with their heart or something else. And sometimes it feels like there's a kind of systems for systems rather than systems for people.
It can feel that way. I completely agree with you, Adam, but I'm also thinking that this is why we need to feel we have the agency, we own our health and well-being, and we can have conversations. We need to understand what would make us feel better and then communicate it. And this is a responsibility towards ourselves that we have that cannot be outsourced and taken away.
Yeah.
But sometimes when there is a problem with mental or physical health capacity, we might feel less able to do so. And this is why carers and advocates are so incredibly important members in our society, because they are able to understand what the person's needs are and communicate them at the times when the person is not able to do this for themselves. Yeah. And this is our citizenship duty. This is our human duty to the society, but to ourselves in the first place. Yeah. And we need to make sure we don't lose that, because that is what can make the systems, this is what can help the systems work better. Yeah. The systems still have work to do to operate better in a jointed rather than disjointed way. There are misunderstandings, there is information that gets lost in translation.
Yeah, absolutely.
And by translation, I just don't mean just translation from one language to another, although this is the case sometimes as well. Sure. But sometimes between departments, information gets lost or misunderstood. So there is work to do, but we also have our duty to ourselves. We have responsibility for our own health. Yeah. And if we're a carer, that's another responsibility for us, because we need to communicate the needs of the person that cannot communicate them at the time, which can happen. And as we are growing older, it can happen to any of us. Yeah. Any of us can be a carer tomorrow. Yeah. We're not today, we can be a carer tomorrow.
That's right.
And we will need to learn to cope with the role. And as carers, we need to also be able to ask for things that would help us to do that role better, because it is an incredibly important role in the society, a role within which the society cannot function.
And I probably would say that working for Northamptonshire Carers, but I do know it from that work, obviously. And I think that there's a few things that spring to mind from what you said. Seeing sort of people as their own best experts, which I think is a lot of around what you're saying, but also recognising, and this was an interesting conversation that I had with Chantal Jones, who was the Adult Care of the Year at the Carers Awards back in September, and she was supporting her older sister who was experiencing issues around her mental health, and was trying, given that her sister was not often in a place, as you're describing, that maybe somebody that's being cared for might not be in always the best place, are able to sort of say how things are for them or explain themselves, that she was trying to do that, and it was a bit of a struggle to be heard, and sometimes arguably you could be there was kind of a sense of being excluded from that, because she was saying things that actually needed to be said but were challenging accepted wisdom, for want of a better phrase.
You're right, and saying things as they are doesn't mean we're heard, which can be incredibly and immensely frustrating as well. And it probably leads to a question you asked earlier: what else is there to do to support mental health and to help evolve
for us, I think as a society, there is a lot we can still do around accepting mental health and without stigma. So we're now at the Open University, we have several modules around mental health. One module that I'm chair of is titled Approaches to Mental Health, which gives kind of an overview of approaches and different ways to approach mental health. There is another module we're currently co-producing to be, I think, newly released in September 2024. And it is about a critical approaches to mental health and society and what role society plays in societal mental health and the mental health of individuals. And it is an incredible opportunity for me to be involved in a co-production of a module like this. And also I have been very lucky to, through my networks, find a person with lived experience that helps me to co-produce one section of that module that I'm tasked with, that is looking, for example, at mental health service users' narratives and how important the persons with lived experiences narratives are, and how we need to hear them, how we as society need to allow ourselves to hear what people tell us, because sometimes we think we listen but we don't hear. And so there is a lot of work we need to do. Part of this module is also talk about stigma. It is such a shame we still have to talk about stigma. Stigma shouldn't need to be discussed anymore. We are all different, and that's how it's right. That's how it should be. That's how it has always been. That's how it will always be. We're different. We come in different shapes and forms. We come with different needs, with different thoughts, with different ideas, and with different superpowers. So I just think we need to action that and be fully inclusive without having to teach about inclusivity and stigma, because this should not need to be talked about.
I'm with you on all of those. That's sort of full disclosure.
So there is way to go. There is still a lot to do for us as a society.
Yeah, absolutely. I worked in mental health for a long time, and I'm sort of in line with what you're saying about sort of, there shouldn't be a stigma. It's okay to be not okay. It's fine to talk about things. We should be doing that. I've sort of had several sort of periods of depression through life. I'm sure possibly I'll experience that again, and that's okay. It's not nice to go through, but it's okay. Experience it. And I think that you're right, that sort of talking about that, employers ideally understanding that better, and supporting people and knowing what might help to sort of maintain people's well-being and keep them in work, or maybe a bit of time out and then coming back again and phased return, or supporting
all of the capacities we have, while taking into account that sometimes we're more able and capable, and some other times we're a bit less. And it doesn't change us as contributing important human being with our place in the society.
Exactly. You still are that person, and actually maybe
even better, more tolerant, and more easily understanding that actually we can all experience depression in our lives. It is never too far. If things happen, if 2-3 things happen at the same time where each of the things is challenging, well, we may simply not be able to cope. And that is what happens, and it happens to all of us. And if we go through it to the other side, we're better for it, we're stronger for it. And through the vulnerability, I think it's the vulnerability that we need to acknowledge that we have, that we become stronger. And I think the society and employers need to understand that it's being vulnerable that makes us strong and stronger. It's not the opposite. We're not stronger because we're never vulnerable. We're stronger because we are.
That's absolutely right. Ronnie Lang, controversial psychiatrist from the 60s, some might say, but he did have some really good thinking.
Need to understand that it's being vulnerable that makes us strong and stronger. It's not the opposite. We're not stronger because we're never vulnerable. We're stronger because we are.
I think that's absolutely right. Ronnie Lang, controversial psychiatrist from the 60s, some might say. But he did have some really good thinking, I'd suggest. And some of that was that kind of what he talked about society leading people to be experiencing what was then labelled as mental illness. Oliver James, the psychologist, I'm reading a book at the moment, which is Affluenza, which I've been meaning to read for a long time. It's really interesting. And essentially, he talks to loads of people in various different countries. Seek it out if you're interested. But basically, he identifies, amongst other things, the nature of society in a kind of free market system. It has an impact. And it's really interesting. And essentially, he talks to loads of people in various different countries. Essentially, and I'm not to go down a particularly political route, but basically, he identifies, amongst other things, the nature of society in a kind of free market system. It has an impact, and seek it out if you're interested. But well worth an explore, I think. That one.
Thank you for the tip. I'll definitely look it up.
Yeah, it's really interesting.
I'm currently reading Shattered Nation, and the other book on my bedside table is The Age Proof from Professor Rosen Kenny, who's actually one of the ambassadors on Take 5 as well. So this is my reading whenever I have a few minutes.
Yeah. I tend to have two going. One that's kind of more serious, that's the Affluenza one. And one that's probably some sort of Scandinavian crime fiction with a detective wandering around. I
love a good detective fiction as well. And PJ Woodhouse. This is my go-to. Yeah. And Alexander McCall Smith.
Oh, is that the it's
the Isabel Dalhousie's novels.
Oh, right,
and also Mamara Motzwe.
That's right. That's right. There's a TV adaptation, wasn't there? The something Ladies Detective Agent.
Yes. The first #1 Ladies Detective Agent or something like that.
That's the one.
No, it's an incredibly kind reading. It's just good for the soul.
Yeah, I think it was Radio 4 or Radio 4 Extra or one of those two that did an adaptation of some of those, the #1 Ladies Detective Agency. Absolutely brilliant. But if you want something to listen to, just sort of relax, or you on a journey or something, I'd certainly recommend that. Thanks so much. We've talked about loads of things. It's been great fun.
Thank you.
And thanks to Jitka for that really interesting, wide-ranging and engaging conversation. I'm sure that we'll be inviting her back on a podcast at some point further down the line. So that is pretty much it as far as this episode is concerned. We're back at the end of March with another one. Until then, I'll leave you with, from the words of the Bard of Manchester himself, I'm the son and the heir of a shyness that is criminally vulgar. Goodbye.
This podcast is created by Northamptonshire Carers and is a Man with a Beard production.